Assessment of minimal residual disease has been extensively studied in lymphoma and has been shown to be prognostic in many lymphoma subtypes. In CLL, we use flow cytometry-based and molecular-based assays to prognosticate based on MRD, to assess MRD. And we also do this now in mantle cell lymphoma in clinical trial setting. However, there is so far no data in follicular lymphoma how MRD can be helpful. So we prospectively evaluated MRD in patients treated on SWOG S0016 study, patients with previously untreated follicular lymphoma who received chemoimmunotherapy, CHOP with either rituximab or radioimmunotherapy. And the assay we used is ClonoSeq, adaptive ClonoSeq assay, where basically we looked at gene rearrangement of heavier light chain gene of the B-cell receptor. And we looked at it at baseline in the lymph node tissue and at 1 year on a bone marrow biopsy. So there are two key findings. One key finding is that MRD status is predictive of outcomes in follicular lymphoma. While the majority of patients did achieve MRD in the bone marrow after 1 year, at 1 year mark after therapy, those patients who did not achieve undetectable MRD had inferior progression-free survival at both 5-year and 10-year time points. So the study clearly shows that MRD status predicts PFS in follicular lymphoma when measured at the end of therapy. The overall survival was not different, likely due to the fact that it is an indolent lymphoma and patients do have multiple treatment options at this point. The second key finding was that we actually were not able to assess MRD reliably in 100% of patients that we tested. In about 30% of patients, due to extensive somatic hypermutation that is typical of follicular lymphoma, we were not able to reliably tell whether these patients were MRD positive or negative. So that's another finding. So the assay needs to improve to capture more patients and better determine MRD status. But I would say that this is the first report of MRD, molecular assessment of minimal residual disease and follicular lymphoma, which shows its prognostic significance. And I hope that in the future, as we generate more data, MRD assay will become used in determining both the duration of therapy and direction of therapy in follicular lymphoma.